Kelsey. Am I good to go? All right, very good. So, welcome everyone. My name is Kent Bradley. in Wichita, Kansas, and Newton, Kansas. I'm a professor and a vice chair of the OB-GYN department and lecture around the Midwest about personal finance and the business side of medicine. And the topic I've been given today is building your practice as a new doc. So we'll go to the next slide. So once you know where you're going to be, then you want to do everything you can to announce your arrival. So sometimes that's in the form of letters to other doctors. And all of this depends on what kind of physician you are and what kind of practice you want to have. So, regardless of that, starting with letters to other doctors to let them know, hi, I'm setting up my own practice or I'm joining this practice. And these are the kind of things that I have special interest in or like to specialize in or enjoy seeing and that kind of stuff. So you want to get your name out there to other doctors as soon as possible so they know you're part of the community. Now, sometimes if you're joining a practice, they may want a letter from that practice to existing patients saying, uh, you know, Associates in Women's Health is excited to announce the arrival of our new partner, Mary Smith. She'll be accepting patients starting this day and being seen in clinic and be helping us in call. And so you may see her name or face or that kind of stuff. So that helps get the word out among your current patients when you're call covering and also gets the word out to existing patients to tell their friends. You'll need a professional headshot or a photo for websites, for the hospital websites, for ads, for social media, for whatever you're doing. Sometimes groups all do the same type of photos with the same photographer so they can make their website all kind of match. And so some are all in white coats and some are just individual in whatever you're wearing with the common background. So if you're joining a practice or a hospital setup, see what they want to use for a headshot. Business cards, yeah, those old things are still used, especially when you put a appointment reminder on the back side of the card. So then as patients are leaving and they get an appointment reminder, they could use your card and then patients can hand out those cards to other people. I am clearly not a social media expert, but there are ways to announce things on social media. Um, I I usually specialize in the traditional methods to start with, and I don't think anything works as well as personal contact, personal letters, personal relationships with the hospital or the other docs. But social media presence for some people and in some specialties helps more than other ones. In OBGYN, it doesn't help so much because nobody picks their doctor by social media. But maybe if it's a cosmetic program or plastics or things that might go more that way. Um, ask the hospital that you'll be working at what they can do to help introduce you to the community. Do they want to have a hospital mixer? Our local hospital, when they get a couple new doctors, then they'll have a social hour in a room off the cafeteria and people can drop by and meet you and they have a few snacks for doctors that way. Or maybe you can see if you can do a grand rounds for them shortly after your arrival and then you're a speaker and you get in front of the local docs. Lots of doctors anymore have digital billboards and they can announce your arrival. Our hospital has one on a major highway. And so then put your picture and your specialty there and kind of start getting it out. But one thing I'd strongly recommend regardless of who you're working for, whether you're setting up with a group or with a hospital, when you're looking for a job, ask them how they plan to promote you and how they plan to help you get busy. Um, because that's kind of their responsibility too when they're recruiting you. And if they don't have an answer, then in my opinion, that's a problem, because they ought to have a way of getting people busy and uh, getting patients in to see them. So that is a key question I would ask. Next slide, Kelsey. So I encourage our local residents and docs to think in reverse. Think like you're the patient. How would you get sent to me? Who would you who would refer you to me, or would you pick me on your own, or how would you most likely, given whatever specialty you're in, how would you most likely get into our office? And then start thinking, how can I make that a smoother process? So, what is the pathway to get to us, and what is your experience going to be like? Um, and so, specifically, if you're going to be sent by referral based practice, if you're a referral doc and people have to be referred into you, then what are the forms going to be like that they have to fill out? And can they access them on your website, or do you mail them out? And when the patient arrives, do not take them back to see you until they're completely filled out, or if they're partially filled out, can you get them back to see you and keep your clinic running on time? So think through the process to try to make it a patient friendly process as much as possible. I've seen a number of docs where you don't budge from the waiting area unless every form is filled out and every spot in every form is filled out. And some of those forms are not relevant. And so make sure your process is patient friendly. Um, and then pay attention to the template you put together for yourself, and schedule to make sure it's what you want and the template works for you. So I talk to our residents a lot about setting up their templates for new patients. Do they give themselves enough time, especially if they're brand new into practice and they're in a brand new practice to them? So early on, they may want to build some extra time into the template so it's a good patient experience and it's a good starting physician experience. And then as they get smoother and learn the new EMR and understand the ways of the world in that particular practice, then maybe they ratchet down the time visits. But maybe you want to build in some extra time early on. And then I'm in a procedure based field of OBGYN. And so I build in extra time for procedures, and I put them first thing after lunch, first thing in the morning, last thing of the morning, last thing in the afternoon, so that there's some extra time naturally built in as well. So think about your templates, but think about reverse. How does a patient get to you, and what will their experience be like getting to you? All right, next slide, Kelsey. Then think about again where your business is going to come from and reach out to those areas. So if you're a PCP, um, then you may want to, uh, reach out to subspecialists. So if you're a internal medicine or a family practice doc and a PCP and you're trying to build a business, should be fairly easy because there's a national shortage of those. But maybe you reach out to the local ortho group and say, hey, I'm new in town and I know you have to get surgical clearances, and this is not the, you don't carry stethoscopes and this is not what you like to do. So here's my card and I have availability in my schedule. And if you need to send somebody over that doesn't have a PCP but needs a knee replacement, then I'm happy to see them. Or maybe the opposite's true. You're a specialist, like I am. And so I reach out to PCPs all the time, and I talk to them about every time we get a new doctor, how can we serve you better? How can we make things go easier for you? Um, so I visit. So when we get a new doctor, I'm the senior partner. I book myself out and the new person out, and we go and visit the offices personally. We bring a boatload of chocolates from Sam's store. And so we meet the docs and we talk to the docs, and usually my new partners give the docs their cell phone numbers so they can text questions or something like that, like curbside consults. And then we go and meet the nurses and the schedulers, and we bring them chocolate and we bring flowers for the front desk. And sometimes we sponsor a lunch. But if you think about how most PCP offices work, um, the PCP has done what they were doing, and then as they're about to walk out the door, the patient says, my periods are getting awful heavy also. I forgot to mention that. Well, that's the last thing a PCP wants to deal with when they have other people waiting. So if I can make it smooth and they say, oh, yep, that's a problem, we need to get that checked out. Associates in Women's Health and Dr. Bradley's, who I usually use. So come on out and we'll get you scheduled to see them, and he can figure out what's going on. And so makes it smooth and seamless for them, and they can take care of the patient and a patient friendly way, but turf it to their schedules and their RNs. So I've created tear off pads that the nurses can have, that have our address and our phone number and how to get from the parking lot to our office if you're in an office building, or business cards. You want to leave all that with the nurses, because most of the time they, walk out and say, this patient needs to see a OBGYN. And then they move on to the next room, and the nurse is stuck with figuring out who and where and how. So if they know you have a new doc in your practice, they'll probably call there first because it's more likely they can get a timely appointment. So if you're a referral only doc, then you need to focus on the big fish. And what I mean by that is, where are the patients going to come? If you're a super subspecialist, who's going to be sending you patients? And you'll probably know that from residency, who sent people to your attendings when you're in residency, and then go meet with them and figure out how to make things smooth for the patients to get in from their office to your office. Because the smoother you can make, the better patient experience you can make, the busier you're going to be. And then really for anyone, you can get your name out in the community. You can speak to Rotary or a local service club, or local clubs that have special interests. You can do hospital ground rounds. You can offer to do a CME opportunity for the hospital. They're always looking for people to plug in and give CME talks. So there's ways to get your name out to the public, and also um, uh, to the hospital and other doctors. There's health minute talk shows and things like that local radio stations would love to have a specialty guest. In our area, there's public television has a doctor show once a week, and they're looking for guests. So there's ways of doing that and getting your name out. But the key is figure out what kind of doctor are you and where are your patients likely to come from. Next slide. And then remember, your office and staff are your first impression to the patient. Can't emphasize this enough. Your nurses, your medical assistants, receptionists, all these staffs are an extension of you, and they are who your patient will see, one, two, or three of them before they ever meet you. So if your receptionists are not friendly, then that is not a good first impression. If your nurses and MAs um, are putting people in room and giving them a hard time about their forms or something else, that is not a good first impression. How about the person that's answering the phones or making appointments? Do you have a person that actually answers the phone, or does it automatically go to voicemail hell? So think about the process as a patient. Um, how is it going to go from arriving at your office, and is the waiting room nice, and is there parking close by, and is it easy to find your office, to making and scheduling an appointment, that kind of stuff. How do your schedulers interact with other offices and patients? So I have a quick story. We had a new general surgeon in the area, and I saw him in the cafeteria, and I said, boy, you must be killing it, because we're trying to send you patients for colonoscopies and bread and butter, stuff like that, and we can't get them in. And he said, really? Because I've got tons of openings. And so we explored this more, and his staff the short version is his staff said, well, he's grumpy when he's busy, so they made sure he was never busy. Um, and then he's less grumpy to them. So they were purposely leaving his schedule fairly open so he wouldn't be busy, so he wouldn't be grumpy. So consequently, we'd call for a colonoscopy and they'd put us a month or two out for our patient. That's not a good plan. So you need to know how the system is working. And then what impression does your receptionist make with patients? What is your waiting room like? You may even want to consider something like a secret shopper. And that's where you have your mom or your friend or a relative or somebody call your office and pretend to be a patient needing an appointment and kind of see what the whole process is like for them and somebody that you can talk to and get the real scoop. So I love secret shoppers. I also, on weekends, will walk through my office and the waiting room just to see what it looks like and how old are the magazines and is it clean and does it look friendly and inviting and do we have business cards out front and do we have a sign that says what the Wi-Fi is for patients to log on if they're playing on their phone, that kind of stuff. Next slide. So we're getting, it's a short talk, so we're getting to the end and then we'll do questions. But one thing I want to emphasize is the best ability is availability. So what I usually advise our residents and our new docs is figure out what your day off is going to be or what your half day off is going to be and protect it like the end of the world. But then the rest of the time that you're going to be in clinic or you're going to be in surgery, you need to be available and you need to be willing to have patients added on if they need to be seen. Because there's no faster way to get busy than to be available when somebody is looking for a doc on a Friday afternoon to help them. Our office is open. We have short hours on Friday afternoon, but we're the only OB-GYN office in the area that has Friday afternoon hours. And we keep the schedule fairly light because we get phone calls of people that are having heavy bleeding or problems that need to be dealt with before the weekend. And we pick up a ton of new patients just by being available on a Friday afternoon for a while. And everybody knows we're the only ones out there that are open in OB-GYN on Friday afternoon. So we get a lot of patients that way. Sometimes there's been a time in the past where we opened up and did well woman exams at 7:30 in the morning. Well, you have to have a receptionist that would open for you that early. You have to have a staff person that will room the patient and be available as a chaperone that early. But if you have early morning type staff or late evening type staff that like those hours and you have a physician or provider that wants to work those hours, then patients love appointments that are not in the set 8 to 5 range because then they don't have to book off work or they only have to book a few minutes off work. So that's that. Next slide. So here is my personal email, and yes, I am old and vintage enough that I have an AOL address. But let's go to some of your questions, and I see some here. Let's go. How to pick a location for a private practice. So I guess I would answer first with first there needs to be need in the area for whatever type of physician you are. But equally as important or more important to that is it where you want to be? Is this where you want to live? Statistically, 60% of people stay within a 50-mile radius of where they do residency. And that's why most residencies are in bigger towns and doctors tend to stay there. It's easier to recruit around there because new doctors already know their practice patterns. They know where they would refer stuff and how to handle things and how the EMR is. So for some people, they stay in the local area because they're comfortable there and they've been there 3, 4, or 5 years. But if I was picking a practice location for a private practice, I would start by where do me and my family want to live? What area? How big a town? And then once I have that figured out, then I would start thinking about what size hospital do I want to work with and what options um, there um, for that. Because hospital, if you're hospital based or if you do anything at the hospital, the hospital has to be a really important part of the thing. Because you may love your office, you may love your staff, but if you hate going to the hospital, that makes half of your life suck. So start with what kind of location you want, and then figure out what the hospital options are, and then figure out if you want to open your own, what's the cost of living, and what's the rent for office space and that kind of stuff. So that's how I would go about picking a private location. But it all starts with what you want to do, because if you build a successful private practice, you're not going to want to move. And if it's not in an area you want to live in to start with, then you're going to be stuck there a long time. How to launch a virtual practice and run it. Um, Not sure what specialty we're talking about there, but if I was setting up a virtual practice and run it, probably need less staff, but IT staff would be more important. You'd have to figure out the privacy issues regarding doing things virtually. And then very high up on my list would be figuring out um, what the reimbursement is for virtual practice. Is it cash only basis and no insurance, or how would you handle insurance in those cases? And will insurance reimburse for that virtual aspect? Um, and um, so that's how I would start with that. And so the nice part of virtual is you need less office space. Most often I see like psychiatrists running virtual practice, and there are existing setups that you could join and do extra hours from a psychiatric standpoint and earn some extra cash and learn the process. And then you can take that information you've gleaned working a month or two at one of these places and use it to help inform you in starting your own. So it kind of depends on what kind of practice. I also know people that are like endocrinologists that have a home base and do virtual out to local hospitals. And so they I'm in Kansas, they contact rural hospitals and have the rural hospitals or rural clinics set up a virtual room, and the patient would come in and they would check them in and they would collect the insurance stuff, and then they'd just um, log on um, the patient virtually with you as the physician back wherever you are, and go through the appointment that way. So sometimes it's partnering with local, or I'm sorry, rural clinics or rural hospitals for some types of practices, and they can do consultant type work that way. It's tougher to do an exam, but there are some virtual setups where you can have a stethoscope or an EKG part of that setup. So again, it would be figuring out what you're looking for and who you want to partner with and who you want your virtual patients. Are they local people? Are they independent? Are they coming through another clinic? And go at it that way. That's how I'd start that. And if I didn't answer your question, she'll flash up my email again, and you can email me, and I'll try to be more helpful. Um, Rothed has another question: how to contract with the local hospital to see admitted patients? Who to contact? Hospital CEO with a random email. Um, so I always like starting with the CEO. Um, that's my personal preference. You can do a random email, or you can call, or if you're visiting the area, you can stop by and see how um, receptive they are, and they may turf you to somebody else. Um, so small hospitals, the CEO runs the thing, and they have assistants that help with specific issues. The large hospitals um, might have a whole recruiting department to recruit things and contract in. Usually contracts will run through the chief financial officer or CFO. Um, But I like to start with the hospital CEO, because if you're running a hospital and if you're smart, and those two things don't always go together, unfortunately, but smart CEOs know that part of their business comes from patients, but a lot of their business is driven by physicians. When a patient's in my office and they need something, I say, okay, you need to have surgery. They say, great, where are we going to do it? And they ask me where I want to operate, and I drive business. So CEOs that are smart know that or that physicians drive business. And so business for them is profit for them. So they're going to be more receptive and more anxious to um, have more physicians on their staff, because that means more patients are coming in. So I would start with the CEO. I think a random email is fine. If they don't answer that, or turf it to one of their deputies to answer it, then I would call them and say, I sent you an email. I'm this kind of physician. I'm looking to expand my practice, and I'd like to talk to somebody about whether it would be of help to you guys for me to um, see your admitted patients or do consults. And if it's a need in that area, they ought to jump all over it, because there's a nationwide shortage of doctors in almost every area. So um, it's manna from heaven when somebody contacts them um, and asks for it. So that's how I'd go about it. I'd start with the CEO. And then how to work a contract with the hospital. Is it RVU based or percentage collections, like 50-50, 70-30? How much does the hospital get? How much private practice usually get? Boy, that's a great question. And the answer is yes. Sometimes it's RVU based, sometimes it's a percentage based. Every single different option is out there. It's usually not 50-50. It depends. So sometimes it would be just you seeing patients in the hospital and you billing it yourself through private practice, or through your private practice, and collecting it that way. That's often how it's done. Some hospitals are closed systems. They don't let doctors that are not um, owned by them round, so they may block you out in that case. Unless you're especially they need, and then you'd want to work a special contract. Um, I have one of my partners and friends that goes to a rural hospital 2 days a week. They fly him out there to do consults, and for ease of life, they pay him hourly. I talked to him when he was setting this all up, and some of the patients are no insurance, or this hospital gets a better reimbursement because they're a critical access hospital than he would get. And so to make his life easier, they pay him hourly, and he just goes out and works for those hours, and pays them so much per surgery. And he doesn't have to do any billing. He doesn't have to collect any patient information or demographics. He doesn't have to do collections. It's just a cash only basis. And that has been an extremely successful model for him, because he doesn't have to chase down people that live 4 or 5 hours away. So any one of those options could be. The hospital may have a preference depending on its setup, but I tend to really like simplicity when I do stuff. Um, I don't have a good recommendation for software. We use NextGen. It is not inexpensive, but there are 1,000 types of software out there. So what I would do for software is ask a lot of questions for recommendations. In other words, I would talk to a lot of groups that are using it, because my personal opinion is every electronic medical record sucks, and you need to find the one that sucks the least and is easiest to use. So that's my cold hard reality of that. What recommendations do you have for specialty docs who are not primary care provider regarding legal protections contracts with the patient? So the short answer on that is, you need to have good legal malpractice insurance. Um, and you don't necessarily have to have a contract with the patient. I mean, you're seeing them as a certain amount of a contract. You can always talk to a local healthcare attorney about if something more specific's needed because you're a specialty doc. But it starts with malpractice insurance. It starts with what protections you have in the state that you're practicing, and whitecoatinvestor.com. Jim Dolly and ER Doc out of Salt Lake City has a book you can get on Amazon for $15 about medical malpractice protection, but it's Jim Dolly or James Dolly, Dahle, has one about every state and what malpractice um, coverages and what medical liabilities there are. Is your house protected? Is your 401k protected? So I would look into that as far as protections. Uh, but I don't think you need special contracts with the patients. You just need the usual HIPAA forms and that kind of stuff. But and those should be readily available to find. So um, okay, what business licenses you need for brick and mortar versus virtual? You need a state license, and you need to talk to insurances if you're taking insurances. Most of them require you to have hospital privileges somewhere, even if you're not rounding in that hospital. Um, but each state will have what they need um, as far as a state license, and then you need to have medical malpractice insurance. Um, Almost everywhere that's required. There's a few states where you can go naked, which is not have any insurance. But most of the states, to get a medical license, you have to have insurance. So you need insurance, you need a medical license. Sometimes you need hospital privileges. Um, and those are the basic things you need to set up a shingle for virtual or mortar, brick and mortar. But then you have to talk to, if you're taking insurance, you got to talk to insurance companies because some of them have additional specifications they need for credentialing, because you have to be credentialed by the hospital and then you have to be credentialed by every single freaking insurance company that you use. And that's every year, every 2 years, something like that. And I don't know where the good malpractice insurance companies vary by state. I'm in Kansas. Camco is the one I use, and it is run by doctors and owned by doctors. If I were in a state that didn't have Camco, which is 49 other states, I would contact the state medical society or the state society for the specialty I was in and ask them what their members are using. And I think we're getting towards the end. You need an LLC or a corporate license application. You don't have to have an LLC, but often attorneys will recommend it as another layer of legal protection. But it all depends on how you're setting up. If you're doing the virtual clinic, that kind of stuff. But if I was setting up a practice on my own, I would get a good business attorney to help you sort through what kind of business protections you need from that standpoint. So I appreciate all of your questions. These were great questions. I hope some of this has been helpful. But there's 1,000 ways to skin a cat, and there's 1,000 ways to set up a practice and practice medicine. That's one of the great things about medicine is you can be private practice, you can be hospital owned, you can be hybrid model, you can be virtual, you have all sorts of options, and you can go anywhere in the country for the most part and do certain types of medicine. So I would think about cost of living, and I would think about where you want to live, and I would think about what malpractice costs in these states. And that helped guide me. I'm in a very low cost of living, relatively low cost of malpractice, and then I travel wherever I want to go. So thank you all for your time. Thank you, Kelsey, very much for helping this old non-tech savvy person get through this talk. I appreciate it. And she put my email in there if you have further questions. Kelsey, is there anything else I need to do? Thank you very much. Have a good day, everybody. Appreciate your time. Have a good Saturday. I'm going to go deliver some more babies.